Sonography of omphalocele. Omphalocele is a birth defect of the anterior abdominal wall, characterized by a centrally located and membrane-covered herniation of the gut, and possibly other organs which includes the liver, spleen, and rarely the stomach. There are key findings that are seen in omphalocele. One of them is that the defect is usually in the midline and not lateral. The herniating organs are usually covered by a membrane, meaning that the herniating organs are not seen floating freely within the amniotic fluid. They are covered by a membrane. The umbilical cord inserts into the distal part of the herniating sac. The image on the right shows a baby with the characteristics of omphalocele. You can see the herniating organs, which is the bowel, covered by a thin membrane with the umbilical cord inserting distally to the herniating sac. This defect was seen centrally in the anterior abdominal wall. It is also necessary to differentiate normal physiological herniation from omphalocele. Normal physiological herniation occurs from 8 weeks of intrauterine life to 12 weeks. The content of normal physiological herniation measures between 4 to 7 mm at the base, and it contains only bowel loops. This helps to differentiate it from omphalocele, which may contain bowel loops, the liver, the spleen, and rarely the stomach. So, can omphalocele occur between 8 to 12 weeks? Yes, the answer is yes. It can occur when the content of the herniation is the liver. So it can be diagnosed at 10 weeks or 12 or 11 weeks if the content of the herniation is the liver or any other organ other than the bowel loops. The sonogram on the right shows a viable embryo that is 10 weeks, 5 days. You can see that there is a defect in the anterior abdominal wall with a herniating sac containing the liver. This herniating sac is covered by a thin translucent membrane that measures above 7 mm at the base. The contents are homogeneously hyperechoic, and this very defect is seen at the time that normal physiological herniations are seen, which is between 8 weeks to 12 weeks gestation. So do we need to wait till after 12 weeks gestation before we can confirm this diagnosis? The answer is no. Normal physiological herniation does not contain the liver. That's one. And it does not measure above 7 mm. But this very one seen at 10 weeks, 5 days contains the liver, measures above 7 mm. So this is omphalocele at 10 weeks, 5 days, and does not need any to wait till 12 weeks, till after 12 weeks for confirmation. It is also necessary to differentiate omphalocele from gastroschisis, since they both involve the bowel protruding through the anterior abdominal wall. Gastroschisis occurs when the midgut viscera protrude through a central abdominal fascial defect and its contents are not covered by a membrane or skin. This differentiates it from omphalocele, which is covered by a thin translucent membrane. The second difference is in the insertion of the umbilical cord. In the case of omphalocele, the umbilical cord inserts distally to the herniating sac, while in the case of gastroschisis, the protruding bowels usually lie lateral to the umbilicus. Most of the time, it is seen to the right of the umbilical insertion. to the umbilical cord insertion. So when omphalocele gastroschisis is seen, it is necessary to apply color Doppler in order to know the insertion of the umbilical cord, in order to differentiate the umbilical cord from the bowel lobes. When it inserts distally to the protruding bowel, then it is omphalocele. When the protruding bowel is lateral to the umbilicus, then it is gastroschisis. When writing the report of omphalocele, it is necessary to describe in details. Avoid just using the term omphalocele. You will need to talk about the cord insertion, the covering membrane, the size, and lastly, the extruded organs. Under cord insertion in case of omphalocele, the umbilical cord inserts to the apex of the herniated mass. In covering membrane, the omphalocele is usually covered by a thin, translucent membrane. You need to talk about it, if it is covered by a membrane or if it is ruptured. Then you talk about the size. Estimate the size of the herniated mass in centimeter and document it. And lastly, you talk about the extruded organs. What are the contents of the omphalocele? Is there presence of ascites, bowels, liver, spleen, and rarely the stomach? The image on the right shows a case of omphalocele. The thick arrow points at the peritoneal cover of the herniating sac. This peritoneal cover is very visible due to the presence of ascites. This means that in our own case, the herniating sac contains ascites and bowel lobes. The liver is intact. On color Doppler interrogation, which the image on the left shows, indicates the insertion of the umbilical cord at the top center of the herniated mass. This has helped to complete the diagnosis as omphalocele. This is a video demonstrating omphalocele, a 26 mm defect in the anterior abdominal wall with herniating mass containing liver and ascites. So we've come to the end of the lecture for sonography of omphalocele. Thank you so much. Please subscribe to our channel to support what we are doing. Thank you.